My name's Dr. James Donovan, and today we're going to be covering important information that you need to know about a medication called Albuterol, a type of medication known as a bronchodilator that is most often used to treat breathing problems. You might also know Albuterol by its brand names Ventolin, ProAir, Proventil, and ProAir Respiclick, or if you're from the UK, Albuterol is the same as Salbutamol. So Albuterol works by relaxing the muscles around the airways in your lungs, which helps open them up and make it easier to breathe. It's commonly prescribed for conditions like asthma, chronic obstructive pulmonary disease or COPD, and other lung diseases that cause shortness of breath or wheezing. Albuterol can also be used as a rescue inhaler to quickly relieve symptoms during an asthma attack or when breathing becomes difficult. Now, in this video, we're going to cover who can and can't take it, how and when to take it, side effects, potential interactions with other medications, information about emergencies and overdoses, plus common questions and where to find out more information. I also want to state up front that this video is not sponsored or paid for in any way by the manufacturers of this medication, and it is purely intended as an informational and educational resource only. So who can and can't take Albuterol? Well, most adults and children can take Albuterol. However, like all medications, Albuterol isn't suitable for everyone. To make sure that it's safe for you, you should tell your doctor if you've ever had an allergic reaction to it or any other medication, if you've got high blood pressure, heart disease, or an irregular heartbeat, if you've got a history of seizures, diabetes, because Albuterol can raise your blood sugar levels, or if you've got an overactive thyroid, and that's because Albuterol can increase your heart rate and worsen symptoms related to an overactive thyroid. Additionally, you should also let your doctor know if you're pregnant, planning to become pregnant, or if you're breastfeeding. So how and when should you take Albuterol? Well, it's available in various forms, including inhalation aerosols, so things like ProAir and Ventolin for adults and children who are 4 years and older, powder for oral inhalation for children who are 12 years and older, as well as solution for oral inhalation for adults and children 2 years and older. When used to treat or prevent symptoms of lung disease, Albuterol is usually taken every 4 to 6 hours as needed. Now, to prevent breathing difficulties during exercise, it's typically taken 15 to 30 minutes before exercising. For nebulizer solutions, the usual dose is 3 or 4 times a day. Now, each Albuterol aerosol inhaler is designed to provide 60 or 200 inhalations, whilst each powder inhaler provides 200 inhalations. Now, you should dispose of the inhaler after the labelled number of inhalations has been used. So now let's discuss how to use each form of the medication correctly, starting off with using the inhaler or the aerosol. So first, remove the protective dust cap from the mouthpiece. Shake the inhaler well and breathe out fully through your mouth. You should then place the mouthpiece in your mouth and close your lips tightly around it. Breathe in slowly and deeply whilst pressing down on the canister to release a spray. You should then hold your breath for about 10 seconds and then breathe out slowly. If a second puff is needed, after about a minute you can take one again. You should then replace the protective cap after use. In terms of using the powder inhaler or Respiclick, remove the inhaler from the full wrapper and ensure the dose counter shows 200. Load the dose by opening the protective dust cap until it clicks. Breathe out fully through your mouth, place the mouthpiece between your lips and inhale slowly and deeply. Hold your breath for about 10 seconds and then breathe out slowly. Close the cap firmly over the mouthpiece, and again you can repeat it for a second puff if prescribed. Now, in terms of using the nebulizer solution, again, remove 1 vial of Albuterol solution from the foil pouch. Ensure the liquid is clear and colourless and pour the solution into the nebulizer reservoir. You should connect the nebulizer to the compressor and attach the mouthpiece or the face mask. Once you're sitting comfortably, turn on the compressor and breathe in the mist for about 5 to 15 minutes. And you should always clean the nebulizer after each use according to the manufacturer's instructions. Always follow your doctor's instructions and use the specific dose that has been prescribed to you, and don't use more or less than prescribed. Now, in terms of side effects, like any medication, Albuterol can cause side effects, though many people don't experience them or only have mild side effects. Now, common side effects can include uncontrollable shaking of a part of the body, nervousness, headache, nausea and vomiting, cough, a throat irritation, as well as muscle, bone or back pain. Now, some side effects can be serious and you should seek medical help immediately if you experience fast pounding or irregular heartbeat, chest pain, rash, hives or itching, or swelling of the face, throat, tongue, lips, eyes, hands or feet, as well as ankles or lower legs. You should also seek urgent medical attention if you've got increased difficulty breathing or trouble swallowing. Now, if you experience a serious allergic reaction such as swelling of the lips, mouth or throat, then you need to call emergency services immediately. So let's move on now and just talk about potential interactions with other medications. Now, it's important to discuss all of your current medications with your doctor when you're starting albuterol, because certain drugs can interact with it, including beta blockers, so things like atenolol or metoprolol, and these can reduce the effectiveness of albuterol. Other stimulants like decongestants or ADHD medications might increase the risk of side effects like an elevated heart rate, and certain antidepressants and diuretics or water pills can also interact with albuterol, potentially increasing the risk of side effects. You should avoid mixing albuterol with herbal supplements and over-the-counter medications unless they're approved by your doctor, and non-steroidal anti-inflammatory drugs, so things like ibuprofen, might increase blood pressure, so use them sparingly. In terms of storage, well, you should keep albuterol in the container it came in, tightly closed and out of reach of children. Store the nebulizer solutions in the refrigerator or at room temperature away from excess heat and moisture, and you should store inhalers at room temperature and away from excess heat and moisture again. Don't puncture or incinerate the aerosol canisters after you've used of them, and dispose them by taking them back to your pharmacist. Now, in terms of emergency and overdose information, in case of an overdose, you should seek emergency medical treatment immediately. Now, symptoms of an overdose of albuterol might include seizures, chest pain, a fast, irregular or pounding heartbeat, as well as extreme nervousness and a severe headache, and uncontrollable shaking or a dry mouth and feeling very sick. Other people might also notice that they feel very dizzy, they're excessively tired, or they have difficulty sleeping. Now, in terms of common questions, some people ask how long does it take albuterol to work? Well, typically it starts working within a couple of minutes when it's used via an inhaler, providing really quick relief from acute asthma symptoms. For nebulizer solutions, it may take a few more minutes, and the effects usually last about 4 to 6 hours. Some people ask, does it affect their sleep? Well, some people might experience trouble sleeping after using albuterol, especially if it's taken close to bedtime due to its stimulant effects. Now, if this happens, talk to your doctor, who might adjust your treatment plan. Other people have asked, can you overuse albuterol? Well, using albuterol too frequently can lead to decreased effectiveness and increased side effects. So if you find that you need to use your inhaler more than recommended, then you should speak with your doctor, because it might indicate that your asthma or COPD or the condition that you're taking it for isn't well controlled. Now, in terms of other information and more resources, please check out the description box of this video, and please remember, always speak to your doctor first before taking the medication or changing it. Thanks for watching, and bye.